Mosquitoes are a fact of life here in Louisiana. As residents of St. Tammany, we must all take the necessary steps to mosquito-proof our homes. Mosquitoes can breed in as little as a thimble full of water, and they can potentially carry debilitating diseases.
We're seeing several new viral illnesses that are transmitted by mosquitoes, such as West Nile for the last several years in our area, dengue fever, chikungunya virus, and now Zika. Most of these diseases began in Africa many years ago. In the case of Zika, it was identified back in 1947 in Africa and has gradually spread throughout the world due to the ability for patients to travel. When infected patients travel from an endemic area to a new area and a mosquito bites them, then the mosquito becomes infected and then can transmit the disease to somebody else. Most patients are going to be asymptomatic. They won't have any symptoms at all. Many patients may feel like they have the flu. In more severe cases, you'll see patients that will have rash, fever, conjunctivitis, a headache, joint pains, and muscle aches. In some patients, and this would be a very limited few, in the immunocompromised patients, in the elderly patients, they can develop severe symptoms, severe neurological symptoms. They may develop confusion, severe headaches, meningitis-like symptoms, and in some cases something called Guillain-Barré syndrome, which is a inability to move the extremities, and it can even lead to difficulty in breathing and necessity to be placed on a ventilator. Once you have Zika, you are probably immune from the virus for life, so that's important to know. The incubation period for Zika is 7 to 14 days, and the symptoms last, if you're going to have them, for about a week. But it's important to note that you are potentially infectious through blood or sexual transmission for up to several months after you've had the virus. I think everybody has to worry about it to some degree because of the potential illness, particularly in those patients who are immunocompromised, in the elderly patients. But the patients, the people who do have spouses that are pregnant need to be worried because they can transmit the virus at any time during pregnancy to their spouse.
The transmission of the Zika virus, we have known we have absolute 3 causes of transmission, and there's also some theoretical causes. It can be transmitted by the mosquito bite, also from mother to child, whether or not it's intrauterine or at birth, coming through the birth canal. And the third way is sexual transmission. It is important to know that when someone does travel, that the woman, because of that risk of passing it on to the unborn child, should delay conception for up to 8 weeks. And for the male, for 6 months. There actually have been reports of the virus living in the sperm for as long as 2 months, but that's why we recommend 6 months of not trying to conceive. And lastly, there are theoretical concerns. The theoretical concerns are blood transfusions, transplants, as well as certain fertility donation procedures such as sperm donation or egg donation. The concern with contracting it while you're pregnant or even passing it to the newborn is the effect on the baby's brain. It can cause something called microcephaly, which is a small brain. Also absence or small brain structures also has been associated with deafness, blindness, as well as stillbirths and miscarriages. If you suspect you have Zika, you should contact your doctor immediately. If someone is exposed in the past 7 to 14 days, they will contact the Office of Public Health, who will order through the state laboratory testing. It's very important for you to have a timeline to give to your doctor, as that information will be necessary for the state lab to order your test. If somebody had suspected exposure over 14 days, a different test would be ordered. To treat the symptoms, we recommend rest and fluids. And you can take Tylenol for aches and pains, for the joint pain and the muscle aches. However, it is very important to avoid aspirin and NSAIDs also known as ibuprofen, Motrin, Aleve, Advil, as this can cause hemorrhage in patients who have similar viruses that are also mosquito-borne and can have the exact same symptoms. However, if somebody is in a Zika transmission zone, they would be tested regularly in the first and second trimester and would receive ultrasounds in the first, second, and third trimester. And if the ultrasound was abnormal, they would as well get serial ultrasounds and be referred to a high-risk doctor. Zika and what we know about it is concerning for all, whether you're pregnant or not. And what we're learning is evolving. What I hope is that people take precautions so that we can minimize the concern in our community. And if you have any questions, ask your doctor.
What's different about dengue and Zika is that dengue is a hemorrhagic fever, whereas Zika really attacks more the neurological nervous system, just like West Nile does actually. But what is similar to across Zika and dengue is that it's primarily transmitted from mosquito to a human back to a mosquito. There's no animal reservoir or no common animal reservoir in outbreak scenarios. Whereas West Nile virus, there is an animal reservoir. The birds are a reservoir for West Nile virus.
We only have a few hot spots that have the Aedes aegypti mosquito. And also, we're not a hot spot as far as travelers go, so people in the South Shore are probably more likely to have problems than we are in the North Shore.
The risk is low here, but that doesn't mean do nothing. These are mosquitoes that are in everyone's backyards. Everyone is breeding these mosquitoes in water-holding containers in folks' backyards. So you got to think about the rain-filled containers, ice chests, buckets, bird baths, kids' toys, tarps. That's where the Zika vectors are breeding. So we have to do everything we can to eliminate the sources of production of those particular vectors in our yard. And so we're rolling out a campaign called Mosquito Proof Your Life, and we're urging people to avoid mosquito bites by wearing long sleeves, wearing repellent when you go outside, as well as eliminating these sources of production. And finally, repairing window screens, using air conditioners when necessary so that mosquitoes aren't coming into your house, and you can reduce your risk of Zika that way.
We have inspectors that go out in the field and they go to people's yards and they're inspecting for different, not only the Zika mosquito, but all mosquitoes. So they'll look for containers and they'll actually dip in there and count how many are there. We have ovo traps that we put out all throughout the district, and they have, I guess, an attractant, and so when the mosquitoes lay their eggs there, they'll bring the papers back, and then we'll actually rear them out to see what species of mosquito it is.
Yeah, we're monitoring all the locations that these vectors are in across the parish every week of the year, essentially, and also monitoring their abundance in each area to develop what is essentially our risk assessment for all the areas across the parish.
Okay. We practice what is called integrated mosquito control. So not only do we go out and spray for mosquitoes, we do surveillance. So we're going out, we're taking landing rates, we're collecting the bugs in the cages and all types of light traps. So we'll bring that information into the lab and we'll find out where the mosquitoes are higher, the counts are higher, and then we'll decide that evening where we're going to spray. We do extensive larviciding. We use no pesticides in our ditches. We either use a light mineral oil or a biological control agent such as BTI, where the mosquitoes have to feed on this.
Yeah, science-based mosquito control is essentially creating data. We're data-driven decisions, right? If you go to a doctor, they're not going to write a prescription without a diagnosis. So we have to diagnose the problem, know where the problems are the worst across the parish, essentially on a daily basis. And so we're out there collecting data to make those sensitive decisions so that we can selectively use pesticides when they're necessary to reduce the risk for the community. And we began working with across parish agencies to make sure that we had a good plan in place. And essentially, once we've done that, we expanded our surveillance efforts so we know very precisely where these vectors are in our parish or where they aren't, as well we've developed this plan that would send out rapid response teams in the event of local introduction of Zika virus. When we're notified of a case, of a travel-associated case, or even if there was a local case, locally transmitted case, we are sending teams out that day to do surveillance in those neighborhoods, to go door to door giving out educational material on how to reduce your risk, and as well deciding whether or not we need to do enhanced control activities, which may include spraying with the plane or the trucks. But we're trying to lower the risk by lowering the abundance of our vector mosquitoes in those areas. And so we're really intensifying this sort of rapid response effort to try to stamp out Zika before it gets a foothold in those areas that may be introduced into.
Unfortunately, part of the problem is that you don't find out you have a Zika case until a human has already come down with it. So, we feel like what we really want is the public to have awareness from the get-go that they need to keep the containers emptied or turned upside down, or get rid of all the water holding containers prior to Zika being spread, because I have found mosquitoes in a Coke bottle cap. So it just can be less than an ounce of water for eggs to hatch off.
You need to investigate your yard and dump out containers essentially on a weekly basis.
Right.
And beyond what you're doing, you need to encourage your neighbors and your family and friends to do the same thing, because it's really a community problem that we're breeding in our backyards. So your neighbors' mosquitoes become your mosquitoes, even if you've dumped all your containers.
I certainly want people to realize that it's only certain mosquitoes that cause this problem, and we have a lot of people that panic when, say, the marsh mosquitoes hatch off and stuff like that. And so that's why we feel it's very important that people know actually what they're looking at.
The benefit of having a local mosquito abatement program is that we're out there, we know our ground. We know the mosquito species that are out there. There's over 65 species of mosquito in the state of Louisiana. To know which species are where and to know how to assess and address that problem is important. And there's so much that goes into understanding that about mosquito ecology that the State Department of Health, what they know best is protecting people's health through data, essentially. Right. And so they deal with all of the data coming into the physician's office. The physician's office are reporting to them about potential cases, and they report to us because we're the local knowledge base about how to control and survey for these mosquitoes across our local area. We're now reaching out to neighborhoods and communities and homeowner associations to host their own mosquito-proof event. We're going to door in these neighborhoods, and we're looking for other neighbors and groups that are interested in receiving that message essentially.
We actually sent, I think, emails out to every homeowners association letting them know that we were available or willing to talk to them, and that's part of what the Mosquito Proof is getting the neighborhoods together.
If your neighborhood is interested in hosting our Mosquito Proof Your Life event, do contact us, contact through our website or our phone number, and we can set one up for your neighborhood.
Let's all work together to mosquito-proof our homes.